My name is Rita Tolbert, and I am with UnitedHealthCare Insurance Company out of Minneapolis, Minnesota.
Rita, how are you?
I'm very well, thank you, Dee. How are
Good.
you?
I'm fine. What brings you and UnitedHealthCare to Charlotte?
Well, we are in Charlotte to put on some educational events in conjunction with the Gantt Museum. And this is our opportunity to get our community, the African American community, engaged in healthcare and empowering them in making some decisions about their healthcare and understanding what Medicare is.
Oh, that's wonderful. We really, really do need this in our communities. I'm so glad you're here. But why do you think it's important to educate African American seniors about Medicare?
Well, knowledge is important because it helps to prepare you to make the right decisions. And our African American seniors are really at a disadvantage because there's a lot more confusion around insurance and Medicare, and things have changed within that arena as well. So the more we can talk to them and educate them on what is happening, how those changes impact them, the better informed that they can be.
Well, can you briefly tell us what's changed and just what is Medicare, Medicaid? What's the difference? What do we need to know?
Well, let's start with, I can tell you what Medicare is. Let's start with that. Medicare is insurance that is offered through the government, and typically you are eligible for Medicare at age 65 in most cases. There are several parts to Medicare. There's a Medicare Part A, which is insurance that helps you with costs that are related to the hospital. Okay. Then there's Part B, and that is focused on doctor's visits. And then there's Part C, which is a combination, but I'll get back to Part C in a moment. Then there's Part D, which is associated with drugs. So that's your prescription drug coverage. So it's insurance that is very much similar to what you have through your employer today. It's kind of replicating that into the older segment. So it's your hospital visits, which is the A, it's your doctor's visit, which is Part B, and then your prescription drug coverage, which is Part D. Part C is offered through private companies, and where they bundle it all up together. So they'll bundle the hospital, the doctor, and the prescription drug all into one package.
What brings you to Charlotte specifically? How are you going to educate seniors here in Charlotte? What are you going to do?
Well, we're in Charlotte to put on a series of events, and so one, we're collaborating with the Gantt Museum and with their Black film series. And through that, I think that's an innovative way of educating. Given that our community, especially the older population, is very much involved into that and is reminiscent of what they've done before, we can work together in that education to try to bring in that health aspect as well as the fun aspect to it as well. So it's really an innovative way of educating.
So people are going to be going to the Gantt Center to see movies,
yes,
movie classics, and then at that time, how will you engage them?
We will have a small segment with that evening and
Okay.
talk a little bit
So
about
you
what
will
we do.
talk to the audience
Yes.
about it. Okay.
And there will also be other subsequent events as well over the weekend and still during this month at other facilities.